Okay. Good to go.
Alrighty. To begin my assessment, I'm first going to gather all my supplies, make sure I have everything, my stethoscope, my vital signs machine, and everything. So first I'm going to introduce myself. Hi, my name is Jessica. I'll be your nurse today. Can I have your name and date of birth? I'm then going to wash my hands, provide privacy. How is your pain today? A scale of 1 to 10. 0, good. Then going to explain the procedure today. So going to be doing a head to toe assessment, which is basically me assessing you from head to toe. Alright, so first I would assess the patient and look at nutrition status, their position, comfort level, and if they have any urgent needs, I would take them to the bathroom. So I would do that, assess their skin integrity, and then check for the orientation. So can you tell me your name, where you are, the president, the time and date, what happened to you, all that. I would then take their vital signs. So I would start by taking their temperature, which a normal reading is 98.6 to 100.4. Anything above that could indicate an infection. After temperature, I would take their blood pressure. Normal reading is 120 over 80. And their heart rate, normal heart rate is 60 to 100. Also, would take their respiratory rate, which normal is 12 to 20. And their pulse ox, or their oxygen, which a normal reading is 92 to 100. And also their pain level. So after vital signs, I would then go on to cranial nerves. So I'd start off with cranial nerve number 1, which is your olfactory nerve. So first I would close one nostril, take an alcohol swab and put it in front of their nostril, see if they can smell it, or have them explain what they're smelling, and do the same for the other nostril. Second cranial nerve is the optic nerve. So I would assess that nerve by using the Snellen's chart. So I would stand 20 feet away and have them read off the letters or numbers on that chart. For cranial nerve 3, 4, and 6, so that's the oculomotor, trochlear, and abducens nerve. I can assess those at the same time. So first I would take a pen light and I would look at their pupils. So I would see for if they're equal, round, reactive, to light. So I would start at this side and go over and see if they constrict. I can also assess cranial nerve 3, 4, and 6 by doing the H movement with my finger. So you put it in front of their face and you would go in an H movement and you would have them look straight. For cranial nerve number 5, which is trigeminal, I would assess that nerve by using a cotton swab. I would have them close their eyes and rub the cotton swab on their face, and they'd tell me if it is soft, and I would do that on their cheek, forehead, and jaw. You could also do it with the other side of the cotton swab if you have like a dull or sharp object. For cranial nerve number 7, which is facial, I would have them smile, puff their cheeks, and raise their eyebrows or squint their forehead for motor. And for cranial nerve number 8, which is acoustic, I would assess that nerve by using the whisper test. So you would stand on one side and kind of rub your fingers together and whisper ABC, and they should repeat it to you, and you do the same for the other side. So ABC, and they should repeat it to you. You do the same for both sides. For cranial nerve number 9, 10, and 12, which is glossopharyngeal, vagus, and hypoglossal. You can assess these 3 together. So you can have them swallow. You would use the tongue depressor to look in their mouth. Have them say their soft palate should rise. And for the hypoglossal nerve, you can have them stick their tongue out and move their tongue. When I'm looking in their mouth, I would also assess for the color of their skin or the mucous membrane. So it should be pink, their tongue should be pink. Cranial nerve number 11, you can assess their shoulder. They should be able to check their shoulders up, so you would press against it. And that would conclude the cranial nerves. So I would then move on to my head to toe assessment. Starting with the head, I would check the eyes, make sure the sclera is there's no redness, any swelling. For the ears, I would make sure that they're symmetrical with their and midline to the eyes. Nose should be symmetrical. For the hairline should be symmetrical, and there shouldn't be any bumps or lumps on the head. I would look at the lips and make sure the lips are moist and pink. I would then move on to check the lymph nodes. So you would first check the preauricular lymph nodes, the postauricular lymph nodes, the occipital lymph nodes, the submandibular, the submental, the tonsillar lymph nodes, the post-cervical and the anterior cervical, and the supramandibular lymph nodes. And there shouldn't be any swelling or any pain to the lymph nodes. Trying to think if I got all of them. Yeah, so moving on, I would then check the carotid artery, and to do that, I would first auscultate. So I would have the patient close, or what's the word for stop breathing? Hold their breath for 2 to 3 seconds, or 2 to 5 seconds, and I would listen, and there shouldn't be any swishing sounds or anything. After that, I would palpate and feel for the pulse and make sure that it's strong, a +2 at least. After the carotid artery or pulse, I would then move on to the arms. I would look at this temperature, or feel the temperature, the moisture, color of the skin. I'd use the back of my hand to feel it, find the radial pulse, make sure that it's strong in there. Also check for skin turgors, pinch the skin, and range of motion. So I'd have them kind of squeeze my hand, lift their arm up and down, side to side. So that is for the arms. Moving on to the heart and the thoracic area. I would obviously not do it over clothing, but just pull it down, let them know what I'm doing. But I would first check symmetry, make sure that everything is symmetrical. Skin tagger, I would check the skin tagger, make sure that it goes back down. Temperature, moisture, anything there. I would first start off by checking the lungs and the air sound. So first I would start on the right side and have them take a deep breath in and out. Do the same for this side. Do it in the 8 spots. In and out. Down here. And I would kind of do it in a pattern, and then I'll listen on the sides as well. In and out. Alright, and then I would check posterior lung, posterior side of the patient by flipping them over. Try not to break in. I would assess the posterior side of the patient, so check the skin, temperature, moisture, any pressure ulcers. And I would listen posteriorly as well, so in my subscript spot. So I would listen in 8 spots. 1 deep breath in and out. And you listen to the posterior side. It should be clear. Alright, and then I would go on to check the heart, and I would check the 5 spots. So the aortic pulse is on the right side of the patient, second intercostal space. I'll go ahead and do it. So aortic, second intercostal space. The pulmonic is the left, second intercostal space. Got that herbs, which is left, third intercostal space. The tricuspid, left, fourth intercostal space, and the mitral, which is the left, fifth intercostal space. And you would go ahead and listen to the mitral for 60 seconds. It should be normal. So that will be all for cardiac area. Moving on to the abdomen, go ahead and let the patient know that I'm going to be pulling up their shirt. And I first would check for, check the overall skin, make sure it's not bulging, check the skin for moisture, temperature, color, all that. I would then first auscultate by listening to the abdomen. You'd start in the lower right quadrant, and you would listen for a minute, and then move up, and then over to the left side, and down. And if you did not hear any bowel sounds for the first minute in the lower right quadrant, you would listen for a full minute, and listen for 5 minutes in each quadrant. So I would then go on to percussing. You shouldn't feel any like dullness or anything unless you're over an organ. And then I would go on to palpating lightly. And again, you shouldn't feel any dullness unless you're over an organ. So, okay. Moving on to the genital area. I would let the patient know what I'm doing. That's part of the assessment. I would check for any discharge, redness, any abnormalities, if there's a tubing, a catheter, or anything. I would find the femoral artery. I would check that, make sure that's strong. And that's about it for the genital area. Moving on to the lower extremities. Pull this down. First, I would check the skin, feel the back of my hand for moisture, temperature, color. I would then check for range of motion, so they should be able to flex their foot, push against my hand, lift their leg if they can do that. I would check my pulses, so my popliteal pulse behind the knee, my dorsalis pedialis, if I'm saying that correctly, on top of the foot, and the posterior tibialis, which is kind of on the ankle. Those should be strong. I would then, that's pretty much it for capillary refill. Also with the hands, you would check the capillary refill. That's about it for the lower extremities. You can also check the balance using the Romberg test. So you would have them stand behind them, have them close their eyes for 20 seconds. They should stand straight and there shouldn't be any swing. You can check their gait by having them walk to the door and walk back. Let's see. Overall, I used appropriate communication skills with my patient. I recorded and documented everything I did with the patient, any abnormalities. I'm trying to think if when I was looking at the mouth, I would check for, I think I already mentioned this, but I checked for pinkness and everything. I forgot to also mention for nerves 9, 10, and 12, I would check their swallowing and their gag reflex. That's important. And I believe that concludes my assessment. I'm done.